the deadline for the ACA's special enrollment period was supposed to be May 15th, but that got moved to August 15th. So you are in luck. Before you go filing your taxes, though, you need to know that the marketplace premiums have been waived for the 2020 tax return time. We have experts to help you navigate all things ACA and Medicare. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services, and Laura Packard is with Get America Covered. They are all here to answer your questions. And so how do you get your question answered? You text your question. The number is 336-379-5775. We ask you not to call that number, but to text that number. Okay, Laura, let's start with you because the deadline to sign up for the marketplace was supposed to be this week. It's now been extended. And so that gives people a little bit more time to figure out what's going on.
Absolutely. You have until August 15th to sign up. However, why wait? Everybody needs healthcare, so go to healthcare.gov now to find out what your options are.
All right, so often people are saying, okay, I see that the deadline is not until August. What about if I pick something and then I decide, ooh, that's not the right thing that I wanted to pick? Can I change it?
Yes.
So what is the process with that so that people can have a better idea?
Morgan, you want to cover that?
Sure. So all you do is log into your healthcare.gov account or call your agent or broker who actually helped assist you with that application initially. Go through, click report a life change, baby step your way through that application. And then when you get to the end, you're going to have your new tax credit that has been put in place, and you'll see all the plans that you're able to select from.
Okay, and then there's something, Laura, that you guys are watching when it comes to the Supreme Court and the Affordable Care Act.
Yes, there is a lawsuit that threatens the entire law itself that has been working its way through the courts for the past couple years, and the Supreme Court is due to rule on that anytime from next week through the end of June. So pay attention. Don't be too concerned yet, but do pay attention to what the Supreme Court is doing.
Okay. All right. So let's also talk about Medicare and timing of Medicare. So Catherine, let's talk about that first and foremost. We're talking about Medicare timing, when you have to sign up for Medicare.
So when you are about to turn 65, 3 months before or 3 months after, so there's a 7-month window there where you have to sign up for your Medicare benefit.
And that starts 3 months before your 65th birthday. It goes to 3 months afterwards. That is the 7-month enrollment period. And if you do not sign up at that time, Catherine, what happens?
You get a penalty. So we don't want you to do that. We want you to sign up. If you're still working, we want you to talk to your human resources department about whether or not you have a credible Part B plan, and then you can decide whether you want to go ahead and sign up for Part B or continue with your health care insurance with your employer. Either way, you've got to sign up during that 7-month period or you will pay a penalty for the rest of your life, and that is not something that we wish on anyone.
Right. Okay. So you need to sign up for Medicare that year of that 65 year. Otherwise, you're going to pay a penalty for the rest of the time that you use Medicare for the rest of your life. Now, a lot of times people get stuck on what do those different parts mean. So let's look at the different parts of Medicare and what they cover and why, so that you'll know what's going on. So Part A covers that inpatient hospital stay. Part B?
Part B covers your doctors and your outpatient care.
Part D covers prescriptions.
Correct.
And then there's something called Medigap.
Correct. And Medigap is the additional policy that you take to help cover the deductible and the part that Medicare does not pay for. There's also a Medicare, what we would call Part C, which is Medicare Advantage. And Medicare Advantage is a roll-up, if you will, of Part A, Part B, and Part D, so that you're part of a network and they take care of everything for you as part of Medicare Advantage.
All right, and Morgan, let's talk about Medicare Part B, because there's a lot of back and forth about what happens with B.
Right. So when you actually turn 65, you're automatically going to be enrolled in Part A. If you've worked your 40 quarters and you're eligible for Part A. At that point, if you have coverage through your employer and your HR department has confirmed that it is considered credible coverage, then you do not have to sign up for Part B. When you go to retire, say at age 67, you simply let Social Security know. You can do that through your SSA.gov account. They will automatically trigger paperwork that will be mailed to your employer to confirm that you have had credible coverage through those 2 years that you chose to work and keep that employer coverage. And then they'll give you your Part B effective date. It'll be different from your Part A effective date when you turn 65, but then they will issue your Part B, excuse me.
Okay, but you have to have credible coverage. So you need to talk to your HR people to make sure you have credible coverage. All right, we're going to be right back with more of your questions in just a moment.